Hello, my name is Misty. I'm going to be your RN taking care of you. I am videotaping this assessment. Do I have your permission to videotape?
Yes, you do.
Perfect. Can you tell me your name and date of birth for me?
Hunter Scow, November 19th, 2002.
Great. In the hospital setting, I would be having my computer open. I would check the patient's wristband to verify the information he gave me and the MRN number to what I have on the screen. Do you have any allergies?
Not that I'm aware of.
Do you have any allergies to medications or foods?
Nope.
No. Great. Okay. Are you in any pain? If you are, 0 to 10, 10 being the absolute worst.
Not at the moment, no.
No pain. Great. Can you tell me your, you've already verified your name, but could you tell me where you're at?
I'm at home.
And what day of the week it is?
It's October 3rd.
Great. And who the current president is?
Joe Biden.
Great. So it's A&O times 4. Then I would, in a hospital setting, I would close the curtain or the door to provide privacy. I'm going to start my assessment at the top of the head, where I'm looking at the skin integrity, also looking at his hair, to make sure that anything is going on, looking for color, texture, any lesions, any redness. And since I'm going to be palpating now, and inspecting everything, I'm putting on my gloves. Now I'm going to be taking a look in the hair just to make sure that there's no tenderness or anything on the skull. I'm also taking a look to see if there's any lesions or masses. I don't feel any tenderness when I palpate.
Nope.
Next, I'm going to palpate the sinuses since I still have my gloves on. Let me know if you have any tenderness. Any tenderness?
Nope.
Next, when I've done that, I'm going to take off my gloves. Do my hygiene. Next, I'm going to look at the symmetry of his face. I'm making sure that his eyes are in line, his ears are symmetry, and that his face is symmetrical to his body, which it is. Next, I'm going to his eyebrows. Everything looks good. All right. Could you look straight ahead for me, please? Now I'm going to test the eyes. Okay. Keep looking straight. Focus on something back there. Now I'm going to test. Look at the pin light. Follow. Don't move your head. And follow the pin light. Great. All right. Everything. He's got equal reactive, accommodated light. So he has pearl. Next, I'm going to look inside of his eyes to make sure that he has nothing going on there. What I want you to do is go ahead, I'm going to just pull down your eyelids a little bit, and if you can look up for me. Okay. Perfect. All right, now go ahead and open your mouth for me. I'm going to just check at my pin light. Go ahead and say ah. Great. Okay. Next, I'm going to palpate the temporomandibular joint. All right, just open and close for me. Great. I don't feel any clicking or anything like that. I'm going to also look in his nose. Just make sure that there's nothing going on. Great. Everything is feeling, there's no deviated septum and all that. All right, since I've touched everything, let's take off my gloves. Next, I'm going to just look at his ears to make sure. Normally I would have an otoscope to look inside. but I don't have one of those. So we'll just go ahead and use the pen light just to look in to see if there's anything I see on the outside here. Again, feeling for anything, don't feel any masses or anything like that. Next, I'm going to check for any tenderness and in his neck. Any tenderness? Let me push down.
Nope.
Okay. I'm going to now assess the lymph nodes. First, I'm going to try check the pre-ocular, the post-ocular, or auricular, the occipital. Any tenderness? Posterior cervical, anterior cervical, submandibular, submental, supraclavicular, and then I'm also going to do the thyroid. No JVD, trachea is in line. Next, I'm going to move on to the chest, in which case I will be looking for symmetry. So if you could just go ahead and just breathe normal for me. I'm checking symmetry to make sure the chest rise is normal. Okay. Now I'm going to just feel to make sure the chest rise is definitely breathing, expansion. And move the back. If you can turn slightly for me, turn that way for me, thank you. Okay. Then I'm going to palpate for any masses or tenderness. Any tenderness?
No.
Any pain? Okay. Just swing you this way a little bit. Again, feeling for any tenderness, any masses. Nothing. So now I'm going to have him say the word 99 and
99. 99. 99. 99.
I'm going to do some checking percuss. Just trying to find if there's any resonance in the lungs. I don't feel anything there. Great. Next, I am going to listen to his lungs. All right. Just need you to breathe for me. All right, if you can turn facing that way so I can listen to the back side. I'm listening to all the posterior and anterior lungs. I heard normal breath sounds, no wheezing, no crackles, no adventitious sounds. Next, I'm going to go ahead and check his skin trigger. Just going to inspect his skin down his arms, checking for any redness, any masses, any lesions. It is warm, normal temperature to the touch. I'm going to inspect his fingernails. Everything's good. Check the other arm. Again, I'm not seeing any masses or any tenderness anywhere. I'm going to check the skin trigger, and there's no tinting. Great. So I have the extremities here. Everything seems to be nice. There is no edema, which is also very good. And that concludes the head and neck and throat and thoracic assessment.